Welcome to the weekly series of Caring Conversations, Empowering Lives for Cancer Care. In this series of events, we come together along with eminent experts in the field to discuss and empower cancer patients as they fight their battle against this disease. In today's event, we will learn about a breakthrough discovery that found new therapeutic targets to prevent cancer recurrence. Then we will hear from our distinguished guest, Mr. Swaraj Borade, how their organization, Agrani Foundation, are helping to spread awareness about cancer and support cancer patients in rural areas of India. We would encourage you to ask questions to our experts by typing them in the comment section. We will take them up at the end of the session. Let's begin today with the session of Beat Cancer Facts. Advances in cancer treatment, like chemotherapy, have been really effective to reduce the death rate for many types of cancer, including breast cancer. However, some patients still experience the cancer coming back even after they have gone prolonged treatment or surgery. In case of breast cancer, 23% of patients experience recurrence within the first 5 years. This happens because some cancer cells are not killed because they stop growing during the treatment. But these cells can wake up and start growing again later. Some scientists have suggested that the process of chemotherapy may itself stop the growth of cancer cells for a certain time, but the main mechanism was not clear. To understand this, a team of scientists from Ramya Ganesan of Emory University, US, and her colleagues did a study using both human cells and mouse models to figure out why this happens. They found that even small amounts of chemotherapy, like the drugs that are used, like docetaxel, they can hurt the healthy tissue around the cancer cells, but not the cancer cells themselves. This injury to healthy tissue sends signal to the hidden cancer cells, telling them to wake up and start growing again. The signals that wake up these hidden cancer cells are called GCSF and IL-6. Scientists think that blocking these signals during chemotherapy might help stop the cancer from coming back. This research shows that it's not just the cancer cells, but also the nearby healthy cells that play a big role in how chemotherapy works. It also suggests that testing for high levels of molecules like IL-6 in the blood might help predict if the cancer could come back early. Finally, this study gives us new ideas for ways to stop cancer from coming back after the treatment. With new discoveries being made every day in the field of cancer, to understand the disease better and also find out novel ways to treat it, we are inching closer towards the hope of having manageable options for cancer treatment. On the other end of the spectrum, we have cancer warriors who are fighting this battle at the grassroots level, interacting with patients, providing them support and sustenance, reaching out even to the rural population so that the knowledge and benefits of these discoveries have far reaching impacts. Today, we have with us one such brave heart who has dedicated his life towards the mission of making an impact in the lives of cancer patients. Mr. Swaraj Borade is a civil engineer with a passion for infrastructure. He started his journey in Sangli, a small village in Maharashtra, and honed his discipline at a military school. He graduated in civil engineering in 2021. During the COVID-19 boom in Indian startups, Swaraj joined the early stage FinShots, backed by Zerodha Rain Matter. He played a crucial role in product and new initiative scaling during his time as one of the founding member at the new initiatives team. The company got recognition as a LinkedIn top startup in 2022. In parallel, Swaraj founded the Agrani Rural Development Foundation, a not for profit organization focused on healthcare, education, and environmental causes. They have been involved in corporate social responsibility projects since 2021, including the restoration of the Kamandalu River and also organizing healthcare camps in Sangli district of Maharashtra. Today, Swaraj works as a consultant to SMEs and startups while leading his non for profit organization. He is building his professional network and presence in the infrastructure sector with a focus on concrete distribution. His journey reflects his dedication to social impact and excellence in infrastructure. Welcome, Swaraj, to our event.
Thank you. I hope I'm audible, and thank you for everyone, and thank you for everyone joining. Thank you, Tapshi, for such kind introduction. It's privilege to be here all today, and with the company with such a dedication for individuals with a common commitment of cancer care. And I feel obliged, and I feel very gratitude feeling for having me here. Thank you for giving kind introduction as well, along with my previous journey. And it's been a wonderful journey till now after completing my graduation in civil engineering. Founding a non-profit organization is not the like a prominent way of people getting into business or getting into space of professional life. But my journey started along in COVID era, where job were very limited, and finding and incorporating a new non-profit organization was like a very shocking decision for my family as well. And they were like, how you're going to earn money and all. So eventually I got into good startup, which is as mentioned by Tapshi, called FinShots, which is India's one of the largest financial newsletter, and which is backed by Zerodha. Zerodha is India's largest equity management platform where you can trade your stocks and all. So along with that, starting ahead, I was assigned to a product called Ditto Insurance, which is by far India's one of the best rated insurance consultancy product, which is completely on an advisory basis. So that's how my early startup career started, and eventually I already started Agrani Foundation. So how the foundation stone of Agrani Foundation started back then in 2021 was all about how we friends look up to traditional non-profit organization. As example, you can call it as a trust, or maybe a Maharashtra state registered trust. So basically, people used to do maybe donation, maybe food drives, and maybe some camps of tree plantation and all. And me and a couple of my friends were like, we are fortunate enough to understand much amount of larger audience that can be catered with this non-profit sort of scene. And maybe Section 8 company and CSR project or something that are booming at that time. COVID time hit, and maybe companies like Tata, Reliances were like heavily invested in corporate social responsibility with the help of government of India. And that's how we got to know that this is the segment where we can brought in some sort of good initiatives for people, for rural people, especially from where I belong, which is a small district called Sangli from Maharashtra, which is from western Maharashtra near the as the Ghat ends. Sangli is a old land of corporates and big politicians, and hence the public infrastructure there is already extremely great. But we wanted to like be in the platform to help us, and to help individuals of very undeserved communities. When I say communities, community is something where we especially focuses upon. We believe that community and community growth is something that is equally led to each other's growth by individual contribution. So we have communities of doctors within us, who are our volunteers. We have communities of student leaders, or we have communities of young politicians who are helping us throughout getting into these sort of corporate social events. As Tapshi rightly mentioned, we have also had privilege to be in one of the great restoration projects, one of our environmental causes, which was in a drought-full area of Kapte Mankad, where we incorporated a entire clean rejuvenation with the help of one of the companies from Pune regarding entire conservation of a river. By that, I can give you a small example. Like, there was a small river with no water which was drinkable or usable, and we made it proudly. Like, right now you can consider it like there are fishes and there are like new plants growing there, and it's like a dream come true moment for an individual with maybe a 22 years of age at that the moment, and to see a bigger impact where rural people are like commending our work and all. So considering that part of non-profit, it's like a very extremely great movement for everyone, for our organization, for our volunteers. And meanwhile, ongoing on the cancer care and advocacy, meanwhile ongoing with this entire session, we can cover it up. So basically summarizing, thank you for having me, and it's been a great pleasure till moment and forward. Looking forward for it. Tapshi, over to you.
Thanks, Swaraj. It was excellent to know about your personal journey and also how that has led you to become involved in patient advocacies. So, you mentioned that your advocacy group is now supporting cancer patients and their families. So, how exactly do you do it now?
So, considering the fact that we were non-profit organization, we are still a non-profit organization, basically focusing upon healthcare, education, and environment. Healthcare was something that were very close to me. That I've seen some of my friends and their family members, even having good resources, economical background, good background in all scenario, they couldn't find good patient group or maybe a good second opinion or something, just because not having good knowledge about what is happening right now in the world. But getting into cancer was not directly a mean of our entire work, because it's first of all very difficult area to be in, and second of all, it is very people oriented and expert oriented sector to be in. Without that, talking on cancer is something which is hazardous for everyone, because giving out wrong information is like extremely bad for anyone. So we started with healthcare and normal patient advocacy, where entire route comes from. So we have, say for example, right now we have 6 to 7 hospitals right now partnered with us, where we subsidize their entire offerings to underprivileged audiences. When I say audiences, these are the peoples who are underdeserved with economical background, social knowledge, and entire exposure to entire scene of hospital healthcare network. So that's how we started. We have 6 to 7 generous doctors that are with us as a supporting hand, and they're helping us. So we have 7 to 8 right now, functionally 5 to 6 patient advocacy group in the form of hospitals who are offering subsidized medical infrastructure to our, we can say, volunteers or maybe community members or anyone who lies in our sector. So that's how I started. Cancer advocacy is something that I fortunately got to know about from Innoplexus itself, which is the company who brought in Curia platform long back, when I was exposed to entire platform, how they bring data synchronization and artificial intelligence in the drug discovery. That's how I got to know about cancer, and the part of cancer which is completely unseen by us. Basically, we started maybe as a company that were involved in cervical cancer, because one of our volunteer got infected with it, and she was like, I am someone who cannot have cervical cancer. How is that even possible? So that's how we got to know that this is the area where there is a lack of knowledge, lack of advocacy, and lack of expert. That's how I got to know, and then led to Innoplexus, which fortunately become our partner in this common cancer cure initiative, and we got to know about that. So we have coming forward, we had a good talk where fortunately I had Tapshi with me in Tasgaon, where we had where we had a event called Talk with Doc. So for all the viewers that are joining, who might think like, what is Talk with Doc? So I initially thought that going to this cancer audience, or maybe people who are exposed, or their relatives, educating them is something that putting like a stone in water. It's like coming back to me. So I understood that this is not the area directly put in my knowledge or put in my experts knowledge. Let's get doctors first and let them understand what is scenario of cancer, and how they can advocate as a first touch point of people and touch point of cancer patients, or maybe a potential one. So we gathered 150 to 200 expert doctors in our area, who are basically from rural area, but these are highly educated people, but eventually be in a like third row of entire scenario when it comes to tier 1 audience. So that's how I got expert from Innoplexus team and Curia app, like Tapshi, Girish from the team, who were like like a god angel to us for at that moment, to give all insights about company as well as the offering for hospitals and doctors. So that's how we are started right now in the cancer advocacy. And going forward, we are being bullish on cervical cancer, because I personally feel if we are working in a rural area, I guess women are something that are completely underdeserved when it comes to giving out any patient care on cancer care. So cervical cancer is something that we are working, and we have a plan to run it entire in Tasgaon and Kautemankar within Sangli, since that's the area where I belong from. And going forward, we are like focusing upon getting into entire Sangli district when it comes to children from 6 to 17 age, female. So that's how right now we are doing on patient advocacy when it comes to cancer.
Thanks, Swaraj, and thanks really for the initiative that you are taking so that we may reach out to more cancer patients throughout Maharashtra and eventually other places in the world as well. And this is really wonderful that we could work together and have this opportunity. So, when you are working with these people, can you elaborate on some of the challenges that you face when you talk to them, the stigma that they face, or lack of awareness, or generally how accepting they are for these kind of information?
So this is one of the best question, I would say, because coming from a rural family, initially born and brought up in tier three city, I've already seen entire stigma of having this very no feature for like no behavior for cancer. When it comes to cancer, everyone like no, this is the stigma that we should be away from. Even some of the people that I feel very unfortunate to see is that they treat cancer as a contagious disease. Sometimes they don't even touch it. So like seeing that coming from a tier 3 audience, or maybe village audience of a rural area, I feel that is one of the issue where there is a lack of understanding when it comes to cancer. Be it any cancer, maybe blood cancer, or maybe bone cancer, maybe cervical cancer. Cervical cancer is something that we have seen personally, because we have run a camp to get information about children who will be willing to be in the camp. So when you talk about concerns or maybe point of problems, I want to give a small example where I personally went to one of the children, maybe you can call it as a student from a school. She was 13 years old, and I told her mother that let's have your children in one of our camp, at least for awareness, and then we can go ahead if she is with enough consent to have a test and all. Surprisingly, her mother was like, no, there are like I'm not giving any comment on it's bad or good, or any religious comment, so be with me, but it was like there are festivals going on and we can't send so our children to any related to cancer or maybe cervical thing. So it was like a very shocking moment for me to see what kind of awareness that we need to do right now, because it's like very bottom line of awareness, and we have to do step by step. So considering challenge, I personally feel awareness is the biggest challenge. Then it comes to consent is something that parents or maybe students or maybe anyone who wants to give consent to check it, even if it's a free, there is a consent problem. So that's consent is something that is a problem. Advocacy is something that is a major problem, where people do not even know that there are different companies, different schemes in which cancer can be taken care of, cancer can be cured. There are different platform where you can get second opinion about cancer, and you can maybe sit on any chair and get experts from any part of world to get to know about your cancer related thing. So advocacy is the major problem, I feel. And but as the non-profit organization and the touch point of a rural audience, I feel awareness is the biggest challenge that I feel.
Yeah, especially when you talk about organizing the camps and all, convincing people to come to these camps and explaining to them the purpose, maybe just to spread awareness or maybe prepare them for taking vaccines or other such treatments. So that is really challenging.
Yeah, I can vouch for it.
So, do you have plans to like expand in terms of the reach and impact in other sections? You mentioned that you are working in the two districts now, but what are your plans for expanding in further?
No, no, when it comes to reaching to multiple people, I personally feel getting to know about entire audience and getting to know about entire sector of healthcare, its education awareness and cancer advocacy is something that we as an organization personally feel, because being associated with both side of sector, that is healthcare, and on the other side, which would be patients, which are rural, mostly rural for us, is something that we want to understand entire knowledge in between and be a bridge between us, so between two of them. So at the moment we have plans to expand it, but initially to get camps within the district where we have good knowledge and where we have good knowledge of democracy, or maybe demography, I'm sorry, and maybe entire government structure where we can get help from, is something that we are looking for at the moment, considering this quarter of the year. But going forward in 2024, we have a better plan to maybe do it in do cancer advocacy and majorly awareness and camps within area of Sangli and within districts of Pune and all. So we do have plans, and we are looking, if there are any people in the chat or maybe joining from any platform, LinkedIn, YouTube, I would highly vouch if you can just share a ping here in the chat, or maybe in afterwards, after the call, that if someone wants to be in the network where we are helping students, minorities, underdeveloped audiences, or anyone who will be beneficial, we are open to collaborate, and we are looking to expand this entirely, maybe not even in cervical cancer, just an entire scene of cancer where any individual can be helped with our network, with our partner network like Plexus, Nuria, Curia. So yeah, we are in the planning stage for that, and we are open to it.
Thanks for touching upon that, Swaraj. So I was going to ask you, so what is the role of volunteers in your organization? If anyone wants to participate, in what form can they contribute to this?
Yes, thank you for asking this question. Volunteers are something like a livelihood of our entire organization. What I can do is just collaborate on the foot and note of getting everyone on one table. But volunteers are something that are extremely commendable at their work and also a backbone of our organization. If, say, for example, someone wants to help us as an organization, as an individual to our organization, I would say there are 3 to 4 different points in which one can volunteer for us. Say if they are in our area, so there is no brainer of being a volunteer and be part of our community events and maybe part of our awareness events. But when it comes to a broader picture, I would say anyone who have knowledge in this entire scenario of cancer, maybe healthcare or advocacy, or say for example you don't have any network or any sort of previous experience, but just want to work with a non-profit organization, so for the sake of maybe relief, or maybe sake of understanding entire scenario, you can help us with, first of all, being volunteer. Second of all, we have a program called online volunteers, where everyone can help us by small activities like maybe administrative work, or maybe planning and strategizing new initiatives, maybe connecting us with different corporate social responsibility events, healthcare, women empowerment events, and arranging a sort of roundtable that we are planning to have, where we are organizing events for community, our internal community, and for everyone open, where we can collaborate on a webinar or maybe on a social media post to give out audience with a right amount of information that they need. So along with volunteers, we can be a partner at administrative work. Maybe if someone is willing to write a content on our website, we are open for that as well, since we are bullish on going on very heavy with content on blogs and media posts. So these are some of the maybe you can call it as a support factor where one can be a volunteer. And I would highly appreciate if someone wants to be with our network and leverage their knowledge and leverage their understanding on the scenario. And at last, if someone is willing to donate us for our causes and to support our entire initiative, they can donate us. We are a non-profit organization, so entire functionality around donations are completely transparent. These donations are completely used as a cause oriented factors of administration and expenses, considering 5 to 10% of administrative charges, which will be shown as a books. And along with that, as I mentioned, we are a non-profit organization with 12A and ATG certification that we can give tax exemption as well. So it is the form of encouragement that people right now see as donating to a company where cause is something that is at the priority. So yeah, these are some of the points in which we can be helped.
Really good to know, Swaraj, and especially because learning about these opportunities and the help that these patients need in the rural areas, it's really important to understand this. And you, as a platform, you provide that opportunity, and you are in touch with the patient. So I'm sure many people would be willing to help you. And to end this, because we are reaching the end of the session, can you share some success stories with us? You mentioned some of the challenges when you tried to create awareness, but maybe I'm sure you must be having success stories as well that you can share with us.
We do have lot of success story when it comes to regular healthcare, that we do have some of our individual members who got supported with CSR events where they had no money to support their healthcare needs. Sometimes they were like, I can't do anything, so let's like pressurize myself and be at home and not do anything on my health needs and all. So we have plenty of success stories when it comes to underdeserved and unpopulated areas where there are like no healthcare needs, that we have brought them to cities. We have brought them to Mumbai, Pune for different sort of healthcare needs. It ranges from supporting someone who has got into accident, have no parents, and to support them. And we have plenty of stories. But I want, as this is the discussion around cancer, this is something that I want to give as a success story. So there was a woman in the rural area of Tasgaon, where we told her to have a one-to-one discussion with our in-house team to around cervical cancer. She was like, there is no need of cancer related thing, especially cervical. I am being very where in a committed sort of relationship. I don't have any problem with my entire hygiene, my entire scenario, and I regularly go to gynac regarding my healthcare needs, especially when it comes to cervical related things. So but we were like, it's a normal awareness session and you can do a self check, and we can sponsor that as well, just as a form of appreciation to start this event, because we were not getting any sort of volunteers to get in. Fortunately, unfortunately, she came. She had awareness session, she had a test session, and it was like, she was like, this is something that I don't need, but let's take it. And afterwards, it was like she was having very bad pain in her stomach, and she was like, this is something that is giving a wrong signals to her. But eventually, after some times, we got to know that she is negative and she is having some different problem, for which we also helped her. But someone might think that this, what sort of success story is this? But some sort of positive nature in her. She was like, this is something that everyone needs. And at least it gave me a point where I could go to different doctor and understand this is not something related to cervical. And it was a positive feel behind with her. When it comes to cervical, this is the success story that we have. Fortunately, none of our entire 10 to 20 women that we did check up on, entirely negative reports for everyone. And it is success story for me when it comes to when it comes to patient advocacy, because these are the people, or these are the female who have no idea what is cervical cancer at first moment. So awareness is also a milestone, because we consider milestone to be on a very particular basis when it comes to advocacy, or when it comes to awareness, or when it comes to success. This is one of the story when it considering to cancer. But other than that, in healthcare, we have ton of story, like 100 to 200 stories. I personally know people that we have given medical grants to. We have a corporate social responsibility fund dedicated to medical grants, where we give grants to people who have no money, or maybe they are into financial burden, and due to which they are not getting their healthcare needs covered. So yeah, we have a success story, and I will be posting them on my social media and on our website, which will be launching soon. We are redesigning it. And yeah, this could be considered as a success story.
And Swaraj, as the global health authorities consider that cervical screening and other such screening should be done routinely, and the aim of all these initiatives is to prevent people from getting cancer, or at least raise awareness so that they know what is to be done. So definitely, when you take this 15, 20 females or whoever for the screening test and they are willing to do it, that in itself is a success. So and I'm really thankful that they were not detected with cancer, because that is what we are aiming for eventually. So I would really consider that. So thank you for sharing your insights. We are nearing the end of the time, but we really appreciate your time and your valuable contribution to today's event.
Thank you so much, Topsy. First of all, being on a platform which is so dedicated to individual and to cause of cancer, be it Amrit, be it Curia, for every cancer patient out there, be it Nuria for all neurological related cancer stuff. We highly obliged and we have a gratitude feeling for having a small organization from a tier 3 city who is trying to expand as much as possible with support from people like you and the organization. Thank you for having me.
Thank you so much, Swaraj. With this, we come to an end to today's event. Thank you all for taking part in this engaging session. We look forward to seeing you again next week when we'll discuss on another important topic related to a cancer patient's journey. Thank you. Have a great day.